prostate cancer doesn't just affect the patient, but also his spouse or partner. Today, we are excited to be bringing on the show today Dr. Ann Katz, who has dedicated much of her professional life to educating and counseling couples and helping them support each other through the prostate cancer journey and thrive as a couple. So listen in.
So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation.
I would like to welcome to the Prostate Health Podcast today, Dr. Ann Katz. She is a widely respected and internationally recognized authority on the subject of human sexuality and how it affects those living with cancer. Dr. Katz is a certified sexuality counselor at CancerCare Manitoba and clinical nurse specialist at the Manitoba Prostate Centre. She is the editor of the Oncology Nursing Forum, the premier research journal of the Oncology Nursing Society. She was inducted into the American Academy of Nursing in 2014. She has educated healthcare providers and people with cancer about cancer, sexuality, and survivorship around the world, and is an avid blogger for the ASCO Connection, the professional networking site for the American Society of Clinical Oncology's worldwide oncology community. She is the author of 14 books for healthcare providers and healthcare consumers on the topics of illness and sexuality, as well as cancer survivorship, including Prostate Cancer and the Man You Love, which was written for every individual who has loved, supported, and cared for a partner or spouse with prostate cancer. In September of 2020, she just recently launched her own podcast, Sexually Speaking Podcast, which is aimed to inform and educate, where she features guests talking about a wide range of topics related to sexuality. Dr. Katz, welcome to the Prostate Health Podcast.
Thank you so much. Happy to be here.
Well, we are very excited to have you on the show today. Now, before we get into today's focus of supporting the man you love with prostate cancer, would you share with our listeners what motivated you to follow the path you have taken to get where you are today?
There's a long answer and there's a short answer. So I guess the short answer will have to do after I finished my Ph.D. 21 years ago. I went and did some extra university courses in human sexuality and, really looked for a population that I thought would really need help in terms of sexuality. And because I'm a nurse by training, the field of diseases, really came to mind and started looking in the literature, and prostate cancer certainly jumped out at me as a real big one. So, that I started a clinical nurse specialist position at our local cancer center. And here we are today, 17 years later, still caring for men and their partners.
Well, that's wonderful. Thanks for sharing that. So why is prostate cancer often referred to as a couple's disease?
That's something I've thought about a lot because, frankly, I think if your partner gets cancer, any kind of cancer for that matter, the couple is involved in it. I think that this description of prostate cancer specifically, I think is because a diagnosis of cancer generally puts men into a state of significant distress. And that really, I think, has an impact because men are socialized not to show emotion and to be strong and have a stiff upper lip and all that kind of stuff. And I think when a man gets cancer, he really needs a lot of support from his partner.
Now, what potential changes can occur in a couple's relationship with prostate cancer?
Well, often in the sexual relationship, the man is often the initiator, not always. And I think being able to have erections for men is really a symptom of masculinity and virility and really tied into masculine self-image. So After treatment for prostate cancer, as you know, one of the biggest side effects is loss of erections, and there are other sexual side effects as well. And I think this really alters the relationship and, makes the man really vulnerable. And it can be embarrassing to talk about this with friends and physicians. So, men often will not talk to their urologist about this, I think for a variety of reasons. But, this distress, this loss of masculinity really impacts on the couple.
Now, when counseling couples with prostate cancer, what advice do you initially offer the partner or spouse right out of the gate upon learning of the new diagnosis of prostate cancer?
I certainly talk about communication, and you will hear this threaded through our conversation today. Often partners and young adult children, for that matter, want the man to have surgery like tomorrow. There's this belief that if you have surgery, if the prostate gland is out of the body, the man will never have to worry about anything again. And as you know, that's not true. There can be a recurrence of prostate cancer. So what I often see is this sort of, this attitude of, have the surgery, get it out now. And that doesn't always work for men. So I certainly would advise the partner to take a deep breath, not impose their views on the man. Certainly, I often find that partners are the ones who look for information and seek out health information. So I think that's a really good role. But just to have patience and let the man decide what treatment is right for him, if the pathology allows that, and really, explore the side effects, long-term and late side effects, as well as immediate side effects, so that the decision is an informed one.
Now, how can a partner best support their man with prostate cancer?
Certainly encouraging to share his feelings. What I see often is that the partner makes assumptions about what the man is thinking and feeling. And, it's certainly something that I do in my relationship. And I think we get it wrong 80 to 90% of the time, no matter how long you've been together. So not make assumptions. Encourage the man when he's ready to really share what he's going through. Certainly I think for a female partner, even though we think we know our male partner really well, you really don't know those really deep, deep feelings. So, to just let him speak, not rush to try and fix things, because some things aren't fixable.
Well, that's some great advice there. Now, looking at from the flip side, for the man with prostate cancer, any tips on supporting their partner?
Yeah, I think sharing feelings, right? It's just that flip side, because the partner is distressed. And we know that very often it is the partner of the man when he's going through treatment who has even greater distress. When I talk to my patients about it, often will say, do you remember when your wife or spouse went through labor? Oh, yeah, I remember that well. Well, what did it feel like for you? Oh, it was terrifying because there was nothing I could do to help her. And I think in some ways it's the same thing. If you have cancer, you've got to have the treatment. You've got to get through it as best you can. Watching someone struggle is really, really difficult.
So now, what advice do you offer the partner or spouse in terms of dealing with their own personal distress that can come with the prostate cancer journey?
Just get help. If you can talk about it without divulging really private things about your partner, but get help. It's like they tell you on the airplane. Remember when we went on airplanes? You put the oxygen mask on yourself first. So get help, be it professional help, if you can share with a sister, a cousin, even an adult child. You've got to, it doesn't help to have two people in distress because they aren't really able to help each other.
In your review of the literature over the years, what have you found are key behaviors to being a happy couple?
So, certainly communication is really, really important. And I find that often couples, particularly after they've been together 3, 4, maybe 5 decades, and really this is the population we're mostly looking at with prostate cancer, couples stop touching outside of the context of sex. And if sex goes away, touching goes away. And there can be a really interesting dynamic that is set up. So the partner stops touching the man because he or she is scared that the man is going to interpret this as initiation, and there is nothing he can do. And, nothing in air quotes, right? Because there's lots you can do outside of penetrative intercourse, but people kind of forget that. The man stops touching his partner because he doesn't want the partner to think that he's initiating because there's nothing he can do. And the result is that people are living like siblings or college roommates. And, I'm not sure that you would choose a partner similar to your college roommate or certainly your sibling. And so touching goes away and people are left with skin hunger. Human beings have an intense need for touch. It produces oxytocin, which is the hormone of attachment or bonding. And so when there's no touch, we really do get skin hunger. So, certainly I think communication about, I just want to hug or I just want to cuddle, and being really clear about what you want and perhaps what you don't want.
Well, lastly, I think our listeners will really gain value from reading all of your books, including but not limited to Prostate Cancer and the Man You Love. Can you tell our listeners where they may be able to find this book, but also more about your other works as well?
Sure. So Prostate Cancer and the Man You Love is now 10 years old, which is interesting. And I'd love actually to do a second edition of it because lots has changed in the prostate cancer world. Certainly any online bookseller will have it. It's published by Rowman and Littlefield. So certainly you can get it direct from the publisher. I've written 14 or 15 books. I keep losing count. I've actually just submitted my latest book, which is about sexuality and illness in general. So, my books really do focus on sexuality and cancer survivorship. I think that most of them, the books for consumers certainly, are written in stories, in narrative form, because I believe that that is how we learn. So I have taken composites of some of the patients that I have seen and put that into stories because there are so many similar struggles, and I really hope that people will learn because I also introduce tips and guidance that is really based on evidence, which I think is so important. We're not sure where Dr. Google got their medical license from, so it's always important for me to use evidence-informed information to educate.
Well, that's great, and we'll try to place some links in our show notes to get to that as well, to your website. And so, Dr. Katz, any final thoughts today for our listeners?
I think the diagnosis of any cancer is really life-changing, not only from a physical perspective, but also from the perspective of so many of us, all of us, right, really think that we know the way our life is going to go. And cancer introduces uncertainty. And I think, what we've seen in the last year with COVID, that certainly I think has informed many of us that, there's certain things that you just can't anticipate and you can't plan for. And that is very much the cancer experience.
Well, Dr. Katz, again, we really appreciate you taking time to share your very valuable expertise today. And I know our listeners will gain significant value from it. Thank you again.
You're welcome.
I want to thank you again for joining me here at the Prostate Health Podcast. Subscribe to the show on iTunes, Google Play, Spotify, or wherever you listen to podcasts. And please share it with a friend who may find this podcast helpful. We'll see you at the next episode.